Kenyatta University Teaching, Referral and Research Hospital was established 10 years back and commissioned by His Excellency the President Uhuru Kenyatta on 10 September 2021.
Ladies and gentlemen, there is no doubt that cancers and renal diseases are increasingly becoming a major health challenge in Kenya. And this facility is positioned as part of our national response to that emerging health nightmare for many of our families across the country.
On the same day, he commissioned the construction of Integrated Molecular Imaging Centre (IMIC) and the Hospitality Centre, a world-class vision of future medicine by Professor Olive Mugenda, the pioneer and chairperson of the hospital. On a mission to enhance his legacy in provision of universal healthcare for all, as stipulated in his 4 agendas. The introduction of molecular imaging center technology is a bold step in transforming the health and medical care as we know it.
A lot of our people are spending huge quantities of money that runs in the billions, traveling outside this country so that they can get treatment. The worst thing about it is that by the time our people are traveling, cancer is normally at stage 3 or stage 4. And they are not going there for detection, they are going there for treatment. Therefore, the idea is that we address this matter comprehensively.
KUTRRH Cancer Care Oncology Centre has a 74-bed capacity and IMIC with state-of-the-art equipment for diagnosis and treatment capabilities that are at par with leading hospitals elsewhere in the world.
Intend that Kenyatta University should be offering specialized services, particularly in the area of oncology. We are very committed and very dedicated to ensure that we offer first-class service.
On molecular imaging, it's for early detection of cancer. However, we will approach cancer from diagnosis to treatment. For diagnosis, the completed project includes an additional 3 Tesla MRI machine for diagnosis and an additional 256 slice CT scan. In addition, the project has acquired a brachytherapy. Just beside the IMIC, there is the KUTRRH Hospitality Centre, which will cater for the accommodation and hospitality needs of patients and their families while at the hospital, and most importantly, ensure prompt access to radioisotopes that have short half-life at the IMIC.
This idea of a hospitality centre came about because of the stories we hear about Kenyans when they go to India and other countries and they are looking for accommodation. And we decided to have a 100-bed accommodation for those patients and their families who will come seeking our services, maybe for a day or 2, because these services don't need the patient to be hospitalized.
The IMIC hosts a cyclotron, 2 PET CT scanners, a SPECT scanner, and PET radiopharmacy equipment. The Integrated Molecular Imaging Centre IMIC will be able to provide early precision diagnosis, possible management and treatment of cancer.
Basically, my work is to diagnose the cancer where the clinicians are suspecting, and then once it's diagnosed, we will show the way to clinicians like where exactly is the tumor and how much is the impact on the person.
While earlier methods used to see the structure of the body, molecular imaging sees the function and the metabolism of the body in real time. The process begins with administering molecular spies, also known as tracers, or in scientific terms, radioisotopes and radiopharmaceuticals created by a cyclotron system for a particular purpose in the body. After injection, these tracers home into the affected area, accurately pinpointing, staining, and mapping the disease or affected part of the body. When projected on a PET CT scanner, cancerous cells are highlighted and appear very bright on the monitor screens. At this level, cancer can be detected early, even before symptoms show up.
It has been noticed in our country that a lot of our patients present late, especially when they have oncology or cancer conditions, and this has led to relatively lower outcomes or poorer outcomes. And we hope that if we can be able to manage the disease in terms of early diagnosis, we will increase the number of Kenyans who survive or recover from cancer.
The molecular imaging can be used to do other diagnoses, like to accurately calculate the amount of blood in the body. Myocardial perfusion imaging, showing where blood is flowing well in the heart, blockages and clots. Molecular imaging technology brings precision diagnosis by offering pinpoint accuracy of the problem in the function of the body.